Let's talk about third spacing and why your patient is full of fluid, but they're still hypotensive. Think of your body's fluids in three main spaces. You have your intracellular, which is inside the cells. You have intravascular, which is inside your vessels, so in your circulatory system. And then you have your interstitial. And your interstitial space is supposed to have a little bit of fluid, but not much. And this third spacing is whenever that interstitial space becomes overloaded with fluid, or the fluid goes in places it's not supposed to, such as in your abdomen, that's going to cause ascites. In your lungs, that's going to cause pulmonary edema. It could also get in places like around your heart and other tissues. When fluid gets in all these places it's not supposed to be, the body can't use it for anything, and what your body needs fluid for most is perfusing the organs. So what causes this? When this happens, think of massive inflammation such as like trauma, burns, or sepsis. And what's happening is your body is sending out a massive inflammatory response, and what it's doing is telling histamine and cytokines, hey, we need white blood cells. And so think of your blood vessels as like spaghetti, like those spaghetti noodle strainers. And you know how they have all the little holes? Well, histamine and cytokines tell the blood vessels to be more permeable. So what's going to happen is all those little holes are going to start opening up. And that's because white blood cells are pretty big. So it needs to open big enough so that those white blood cells can escape the circulatory system and go to wherever the body needs it to go. But what also happens is not only is white blood cells escaping from the circulatory system, albumin is also escaping, and albumin is a very important protein. It tells fluid to stay in the vascular space. So if albumin is leaving, fluid is also leaving. So now all this fluid is leaving the second spacing, which is the circulatory system, intravascular space. And when it's leaving, it's going into places it's not supposed to. And now we don't have any fluid in the circulatory system. So now we're going to become hypotensive and the patient's going to go into shock. So when you look at your patient, they're going to look like they're full of fluid, and they are full of fluid, but it's just all in the wrong place. So yeah, that's what third spacing is, and that's how it works. Your patient is full of fluid, but it's just all moved to the wrong place.